This week on Healthy Living, a look at universal health coverage, seeking quality and affordable health care for all. WHO representative to Zimbabwe shares some insight on the measles outbreak in the country. And a new malaria vaccine could be a game changer in the fight against the mosquito-borne illness. Plus, from corn to bananas, we'll have a taste of organic farming made in Morocco. We'll have these stories and more in this edition of Healthy Living. Hello, thank you for joining us for another edition of Healthy Living. I'm Linor Moudou. At least 50% of people in the world do not have access to the medical care they need, and 100 million people fall into poverty due to medical expenses, according to the World Health Organization. Observers say universal health care is key to afford all people access to health services they need without the financial burden. They say universal health care aims to ensure access to quality health services, safeguard all people from public health risks, and protect from impoverishment due to illness. Proponents of universal health coverage say it makes it easier for all patients to seek treatment, but opponents say it has several disadvantages, including diminishing the quality of care people receive, such as having to wait for a long time before seeing a specialist. Services through universal health care are fully or partially funded by governments. Increasing health insurance coverage is a strategy countries have adopted to achieve universal health coverage. Let's go to Rwanda, where a health insurance scheme launched by the government is allowing indigenous communities better access to health services.
The indigenous people of Telembele village in Rwanda have historically had a difficult time accessing basic health care services. The main challenge has been the cost of health services. The government has taken some steps towards bridging this gap through an insurance program called the Mutuelle de Santé.
Upon leaving the forest, we were living in isolation. We were scared of going to hospital. Pregnant women were giving birth at home. When the president knew our rights, he paid for the health insurance, and thanks to that, if we get sick or when our children do, we can go to the hospital for care.
Assistance is based on financial need. This entails 5 financial categories from A to E based on household income. Level E households are those with the lowest income. These households are provided with health insurance that covers basic care at no cost and medications at a reduced rate. According to officials, the majority of the indigenous people here are in category E.
Among the patients we receive here, there are some of them are indigenous, and those indigenous, the care they receive are for free.
Before the support of government, it was hard to me to get the fees of health services.
Health officials say that community engagement is needed to help build trust. One answer is working with community health workers in every village known as abajyanama b'ubuzima. Their work includes sensitizing people about various health matters, visiting households to check health status, reminding pregnant women about their prenatal checkups, as well as parents about their children's vaccinations dates.
My firstborn suffered from worms, and when I asked elders how I should help my kid, they urged me to look for herbs in the garden. As soon as I was given the health insurance, I brought my kid to the health center and he got treated. I paid 20 random francs only.
Category E members also benefit from other social services, such as subsidies for solar-based domestic electrical systems and nutrition programs.
Professor Mohamed Nasir Sambo is Executive Secretary of Nigeria's Health Insurance Scheme. He tells us more about the challenges and opportunities of universal health coverage.
Once you are employed in an organization that has about 10 staff and more, part of your salary and contribution from your employer will be collected and pulled together in the National Health Insurance Authority. Then you are provided with health care. The hitch that we had then was that the law did not make provision for informal sector group, which are in the large majority. So the universal coverage has three main elements. How do we ensure that the entire population are covered? How do we expand the services? How will you use the concept of financial risk protection? If you don't have any mechanism of getting easy healthcare services, people are bound to get into poverty. And poverty can lead to other healthcare challenges. And that is a vicious cycle. How will it be implemented? One of them is to have a very sound social health insurance system. And second is to have a very sound supply side system whereby primary healthcare will be functional, secondary healthcare will be functional, and the tertiary healthcare will be functional. It is expected that policymakers at all levels should pay premium and should put the universal health coverage into the agenda so that all bottlenecks that constitute barriers to access to quality healthcare will be eliminated. And the benefit is that when you have people having access to healthcare without any difficulty, you likely have a very healthy community, healthy people, a healthy community, productive community. It's a policy that seeks to protect the poor. The rich, they have access to healthcare services, whether you have universal health coverage or you don't have. But to say that we have a declaration at the national level, it shows a concern for poor.
Trials of a new malaria vaccine developed by Britain's University of Oxford show it is 80% effective, meaning it has the potential to save millions of lives and eventually eradicate the disease. Henry Ridgewell reports from London.
The malaria vaccine, named R21, had already shown encouraging trial results after 3 primary doses. But maintaining that immunity has always been a big challenge.
One of the worries was that this would be short-term protection and only last for a few months. That's definitely not the case with the data we're releasing today, and indeed 80% efficacy in the second year of follow-up after a booster dose.
The latest Phase 2 trial involved 450 children aged between 5 and 17 months. The results, published in the Lancet Medical Journal, show the higher strength booster dose was 80% effective in preventing malaria infection.
This is a parasite we're trying to vaccinate against, not a virus. It's got thousands of genes, complex to design a vaccine. Over 100 have been in clinical trials, and this looks like the best data so far.
Malaria killed an estimated 627,000 people in 2020, the most recent available data. The vast majority were children under 5 in sub-Saharan Africa. The World Health Organization approved the first ever malaria vaccine in October last year, called RTSS. But R21 may offer even greater hope.
A vaccine with high efficacy like this should be able to save hundreds of thousands of lives a year. And then we'll be looking at a vaccine that could actually eliminate regionally and eradicate globally this terrible disease.
Results from the ongoing Phase 3 trial involving 4,800 children are due later this year, and scientists hope to begin mass production in 2023.
Zimbabwe is struggling to contain a measles outbreak that has killed nearly 700 people, most of them children and young people. Health authorities have since been struggling to contain the infectious viral disease, which causes a rash, cough, and high fever, and can be fatal for unvaccinated children. Dr. Alex Ntale Gasasira is WHO representative to Zimbabwe. He has more insight.
For this initial phase, the vaccination campaign has been limited to the children from 6 months to 5 years. But we are seeing quite a number of children above 5 years who are affected. What this sort of indicates to us is that we may have to expand the age group that we are targeting for this vaccination campaign to go up to children of 15 years of age. We are doing our best to build capacity, again, across the country, retraining health workers. Measles had not been seen for 12 years in this country, so some of our frontline health workers have to be retrained on how to recognize and manage cases. We are working together with the government to, intensify resource mobilization to generate more resources to ensure that we have a comprehensive capacity across the country. As we respond to emergencies, we need to concurrently ensure that essential services like immunization get the attention they deserve.
From corn to bananas, all the produce grown in this farm is organic. The farm, called Jenan Lakhbir, is located in Darboza, a city 20 kilometers west of Casablanca. It was created in 2003 by Fatouma Benabdembi Jarari, a former sociologist who switched to organic farming. Take a look.
On utilise l'eau à très petite quantité.
We use water in very small quantities. Agroecology is really the soil health. It's important. We haven't paid much attention to the soil, even though soils are the basis of everything, and therefore soil health cannot be achieved without fertilizers.
She's using organic compost made of hay and cow dung and reuses the seeds of vegetables and fruits to replant them.
70% of agriculture is small farmers who have less than 5 hectares. That means we can support them a lot to go and develop this agriculture. There are people to do it. There is already know-how that we simply have to readjust, update, and correct if necessary for sustainable agriculture. In any case, all of Africa must move towards organic, sustainable agriculture.
Higher yields and sustainability can help prevent food insecurity, an issue the UN reports an estimated 346 million people are facing in Africa. Jarari also welcomes visitors to tour the grounds and enjoy a homemade meal straight from the farm.
I love the idea of visiting a durable farm, because I've never gotten the chance to see that in France, and I think this is the future for us as human and as humanity.
Organic farming is on the rise in Morocco, according to this independent organic farming expert.
It developed in Morocco from 4,000 hectares in 2010 to 12,000 hectares today. And in terms of production, we've reached 120,000 tons. 21,000 tons are destined for export, and the rest is marketed in the local market.
Organic fruits and vegetables can be sold for about 20% more than their conventional farming equivalents. And studies show that foods grown with less pesticides can be beneficial to brain development.
I chose organic agriculture for several reasons, including offering the consumer a clean product. And I no longer use chemical products and fertilizers. That is why I prefer organic agriculture.
And Jarari says if we take better care of the earth will take better care of us.
Today we have to understand that the way we react and behave with the earth. So, if we can change our behaviors, I think we will experience less impact from climate change.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at @linochmudu. Until next time, stay well and strive to make every day a healthy day.